Hi. So today we'll be discussing the treatment aspects of menopause. If you refer to my previous capsule, we were discussing all about why you get menopause and what are the symptoms of menopause. So I suggest you have a look at that capsule first. So when we treat menopause, we look at two things. Can I treat you by using estrogen, or can I treat your individual symptoms of menopause? Since the root problem of menopausal transition as well as menopause is the lack or decreasing levels of estrogen, it's logical to think that we can just treat you with estrogen. And that's exactly what we used to do. Up to around 15 years back, we used to give nearly all our postmenopausal women estrogen. And we used to see dramatic benefits. The hot flush used to go, the night sweats used to disappear, bone density used to go, the urinary complaints, vaginal dryness, everything used to disappear. Libido would increase, you'll feel younger than what you actually are. So all was well till around 15 years back. Then we got two clinical trials. I will leave the links in the description below if you want to have a look at those trials, those clinical trials. But those clinical trials basically shook the HRT world. The outcome of the trial showed that all the symptoms of menopause were well treated by hormone replacement therapy. They also showed that there was an improved bone mass, and so the rate of fractures were decreased. They also showed that there was a slight increase in breast cancer, which again we expected that. But what surprised us was that there was an increased incidence of heart disease and strokes. Now we find that unacceptable. So after those trials, there's been a shift in the way we manage patients in menopause. Instead of giving ladies long-term HRT, we have now started giving you short-term HRT. And we always discuss the pros and cons with the patient before we prescribe. We explain to you very clearly in detail what are the disadvantages and what are the advantages, and make sure that you're very clear about what you're getting into. One group of patients really benefit from HRT, and those are the patients who have had surgical menopause. And when I mean by surgical menopause, it means when your uterus and ovaries have been removed. So usually patients like that who have had your uterus and ovaries removed, you nearly always require some amount of HRT at least for a short time. So any long-term HRT given definitely improves your bone mass, but it comes at a price. And the price is increased incidence of heart disease, increased incidence of strokes, and increased incidence of breast cancer. Accordingly, we are always looking at safer alternatives. So what is your safer alternative? So we will look at treating only the symptomatology. One is hot flush, second is vaginal dryness, and third is lack of bone density and the fractures which come with it. So can we treat them individually? So there are drugs which we can give you which help you for your hot flush. There are also tablets and creams which will help your vaginal dryness. And there are drugs which mimic estrogen without the side effects, or at least less side effects, to help your bone density. So how do I treat women in the menopausal transition? Now in the menopausal transition, you're still having your periods. And if you're having your periods, I can't give you estrogen. So we do have some plant-based estrogens which come from cereals or from soy, and they can give you some marginal benefits to help some of your symptoms. So what about lifestyle change? Now the best gift you can give yourself for menopause is a very healthy lifestyle before menopause. You'll find it very difficult to lose weight, very difficult to improve your cardiac fitness after menopause. So if you can hit menopause with a very strong bone mass, and if you can hit menopause with a very strong heart, most of your problems are solved. So how do you get good bone mass before menopause? By three things: good amount of sunlight, weight training exercises, and calcium rich foods or calcium supplements. But for all the calcium supplements or for all the vitamin D supplements I give you, if you do not exercise and if you do not get your sunlight, none of the calcium is going to be deposited on your bones. So it's very important that you get your weight training exercises and sunlight in your 30s so that the bone density is really good by the time you hit your 40s. The other issue I discussed with you was that you lose your cardiac protection after menopause. So you need to improve your cardiac fitness before you hit menopause. So do your cardio activity, so like running or jogging or swimming, stuff like that, which will improve your cardiac fitness. Again, this has to be done before you hit menopause, so that when you are menopausal, you have an incredibly strong heart. So another gift you can give yourself is having the perfect weight to height ratio when you become menopause. You'll find it very difficult to lose weight after menopause. Your basal metabolic rate has dropped, you'll have some bone pains, and you'll find it difficult to lose weight. You can lose weight much easier in your 20s and 30s and early 40s, but not so in your late 40s and in your postmenopausal state. By losing your excess weight or maintaining a good weight into your menopause, you're going to give your bones less unnecessary strain and stress. So it's important that your pre-menopausal weight is ideal. Even after you hit menopause, it's always a good idea to maintain a correct diet, a good balanced diet with some amount of dairy, good amount of vegetables, and some amount of fruit is helpful. But you also need to remember, because your basal metabolic rate is quite low, you really don't require a lot of carbohydrates. So you need to watch your calorie intake after menopause, otherwise you'll find it's very easy to put on weight at that age group. And there is nothing like exercise to keep you fit. And there is no better mood lifter than being fit and looking fit. Many women somehow feel that menopause is some end stage of life. I disagree. Your first 20 years went with puberty and education. Your next 20 years went in marriage and reproduction. So if you've lived your first 40 years of your life well, exercised well, looked after your weight, improved your bone density, you'll find that the next 40 years, your post-menopausal age, is going to be the best time of your life. So all you need to do is overcome this tricky menopausal transition. And after that, you're a free bird. Free to do whatever you like. Even go to space. Age is just a number. Bye.